have this BDNF adequate in our brain. Oxidative stress, BDNF, and yoga. Antioxidants are the weapon of choice. So they are the molecules that fight the free radicals. They neutralize the free radicals. Antioxidants soak up free radicals like sponges, so soaking up dirty water. Regular yoga training can decrease free radical formation and increases the antioxidant system. And yoga should be considered one of the therapeutic methods for relieving stress and overall well-being of the brain and body. Yoga has been shown to actually boost the BDNF factor. So these are all research-based, So they have researched and found all these facts behind using yoga as an alternative system to combat all these stress. Effects of yoga on gray matter. Now we are coming to look into the anatomical background. Gray matter is a major, I'm sorry if I am boring, I need to explain all these background before going into the actual techniques. That's how you will understand why we are doing this stuff, so that your compliance might be better in doing yoga. Gray matter is a major component of our central nervous system that is involved in memory and speech. We all lose some gray matter volume as we age. This is an unfortunate truth, but it's not inevitable. Sometimes if you commit some mistake, your superior might ask, do you have enough gray matter? So that is how the gray matter is so important for our cognitive function. Studies have identified differences in gray matter volume between long-term mindfulness practitioners and control. Yoga meditation practitioners exhibit greater gray matter volume and fewer reported cognitive failures. Slowly my anxiety level is down now. I'm getting used to. Recently, a study looked specifically at yoga and found that controls, that is a control group in the study, displayed the well-documented age-related gray matter decline. With age, we all lose gray matter, while yogis did not, suggesting that yoga contributes to protect the brain against age-related decline. How amazing is that? We can reduce. See, one increased threat with the aging population is the Alzheimer's disease and the dementia. That is what most of the Western countries are suffering mostly from. So this, you forget who you are. That is a very worst thing to happen to any human being. It's okay to be dependent, but you have to be conscious about yourself, right? You lose your consciousness in dementia and Alzheimer's, which is really pathetic. So that is what we can prevent by doing yoga. The last one is the most important muscle, one of the most important muscle in our body, the iliopsoas. It's called as muscle of the soul, iliopsoas. It's important muscle connecting the spine to the lower limb. It is connected to the diaphragm too. That is what we all miss. This is the iliopsoas. It's actually three muscles. Iliacus, this is the ilium, our pelvic bone, and this is the psoas major and minor muscles. So they all combine like as a tendon, come down, and they attach to our thigh bone femur here. So that is a very important connection. It is called as, its main function is hip flexion. When I'm sitting like this, my psoas muscle, iliopsoas, is shortened. That is what happens when you are constantly sitting in front of computers, working in computers. And now at home, no work, people, even those who have active jobs, now sitting at home, doing nothing, sitting in front of TV, sitting for a long time shortens this iliopsoas muscle. Prolonged sitting, stress, anxiety, poor posture can cause dysfunctional psoas muscle. And a dysfunctional psoas muscle also can contribute to stress, anxiety, and poor posture because it is attached to the diaphragm. So when it is attached to the diaphragm, it's going to disturb the function of the diaphragm, and Through vagus nerve, this diaphragm and the villosovas can influence the brain and cause more stress. Therapeutic approaches. There are several therapeutic interventions available in the management of stress, anxiety disorders, and depression. There are several modern therapies available nowadays which are proven very effective and are evidence-based. Importantly, the cognitive behavioral therapy and psychoanalytic therapy play a vital role in the management of such psychological issues. Psychoanalytic therapy. In psychoanalytic therapy, looks at how the unconscious mind influences thoughts and behaviors. It's important that psychoanalytic therapy speaks about unconscious mind. Psychoanalysis frequently involves looking at early childhood experiences in order to discover how these events have shaped the individual and how they contribute to current actions. Psychoanalytic therapy also makes use of other techniques, including free association, exploration of transference, observing differences, and feelings patients may not be aware of, as well as dream interpretation. They are trying to use all these feelings of unconscious mind as well as conscious mind as a therapy. On the other hand, we have the CBT. It's all about more than identifying thought patterns. It is focused on using a wide range of strategies to help people overcome these thoughts. Such strategies may include journaling, role-playing, relaxation techniques, and mental distractions. It's mainly based on the vicious cycle of our thoughts, perception, and behavior. That is the cycle, the ABC model of cognitive behavioral therapy. So it all depends upon the event. The events could be the world, other people, personal experiences, personal history, future self, whatever we are looking into. Right now, we are looking into the world like with no clue. Particularly, I think for Chennai people right now, there is no clue when their lockdown is going to be released. So next comes the thought. The thought is a person's individual thing. The attitudes, rules, demands, beliefs, images, meanings with the previous experiences, That processes with the emotions, the healthy feelings, unhealthy feelings. The thought is influenced by these two feelings, the emotions, the physical sensations, and the interaction between these three decides the behavior, whether a constructive action or a self-defeating action, whatever it is. The interaction between the ABC is the main thing. So what they say, they ask their patients to analyze their thought, sit and read your thought, and then they discuss whether their thoughts are right or wrong. If they have a wrong thought, then they try to intervene and try to correct the thought. That is the main background of this cognitive behavioral. There are other tools as well, but this is the main basic of the model. So what happens? I believe like in the cognitive behavioral therapy, they don't speak anything about the subconscious mind. As I told you before, when a person's SAM axis, HPA axis, everything is activated, do you think he will be able to sit and read his thoughts? I don't think so. They cannot do that. The person will not cooperate. So I believe that the psychologists and therapists would agree with me if I mention that it's not an easy task to get the person actively involved in the process, at least in the starting stage. We have to create a level playing ground which is conducive so that a person can sit down and read their thought and analyze their thoughts. Otherwise, he's not going to cooperate. Critics who claim that psychoanalytic therapy is too time-consuming, expensive, and generally ineffective. Some, such as Noam Chomsky and Karl Popper, suggested that psychoanalysis lacked a scientific basis. Cognitive behavioral therapy doesn't tend to focus on underlying unconscious resistances. This is what is the flip side of cognitive behavioral therapy. Becoming aware of these thoughts does not make it easy to alter them. Of course, I know that I've got a wrong thought, but is that easy for me to listen to a therapist and change my thought process? That is questionable. The individual must be ready and willing to spend time and effort analyzing their thoughts and feelings and finally willing to change. I have lots of patients, who go for this counseling and behavioral therapy, when they come back during my next physio session, I ask them, how was that? Everyone, mostly almost 60 to 70% people say, oh, yeah, I just went and spoke. We keep on speaking. That is the reaction we get. That means they're not actively involving themselves into the therapy. So how beneficial that therapy is going to be for them if they are not actively involved? So that's where the need comes for the therapy integration. Integrating yoga therapy into the behavioral model could help to bridge the gaps and produce a situation which is conducive for the individual to become more involving and motivated. This effect is achieved by connecting the behavioral cycles with the yoga therapy tools through the strong organic connection, which is the breath, brain, and gut. Breath has proven as a very strong mediator in influencing the brain and connecting the behavior therapy cycles with yoga meditation cycle. And that connection is based on the neurobiological, neurophysical, neurochemical, and neuropathophysiological foundation. Nothing, of course, all these techniques are taught by our ancient sages and gurus, and they are refined and refined and refined by many modern gurus, but they all have this much of scientific backup. Yes, we are going to utilize all these processes that we saw so far in building this model. So these are the cycles, In the behavioral therapy model on the left side, you have the core beliefs which influences your thoughts, feelings, and behaviors, which will in turn influence your rules and assumptions. So they make a person sit and analyze their thoughts, and then they try to relate between the core beliefs of the person and the rules and assumptions. There can be a false assumption, which they will try to correct. Everything happens in your conscious brain level, On the other hand, the yoga cycles, they have the breath, body, and mind. Yoga believes that there's a strong connection between mind, body, and breath. You can influence your mind through breath or body. So if you incorporate all three, you can influence and treat your bodily symptoms by influencing it through your breath and mind. You can treat your mind by connecting the breath and body. That's what yoga cycles are. So the gut-brain axis and therapeutic interventions. This is where the gut-brain axis comes into play. We have the cranium. As I told you before, there are three cavities: the cranial cavity, the chest cavity, and the abdominal cavity. It should be like abdominopelvic cavity because it also involves mainly the pelvic organs as well as the iliopsoas muscle. So in the cranium, we have the brain. The chest, we have the respiratory system, the lungs, and the abdomen, we mainly have gut. We can influence the brain through our gut or through modifying the breath. This is a scientific intervention which our yoga and yoga instructors, yoga gurus have been using from the time unknown, So they knew probably these signs. GBA link to therapy, the gut-brain axis link to therapy, link between organs of three cavities. It mainly linked through the vagus nerve. So whatever we are going to do, majority is going to be influencing the vagus nerve. Psoas muscle, psoas, the muscle of the soul, as we saw, we have to manage. It's chronically tight, particularly now as you are sitting for a long time. When you sit, the psoas muscle is shrinking, so it causes tightness in the psoas muscle, which is going to impact the function of the diaphragm, and that's going to affect the brain function, the cognitive function. If we have a functional gut, that will produce a relaxed breath, and that will calm down the brain. So that will bring about a clarity in the mind, which will be conducive for any therapy. So what happens, the ultimate result is there is no fear, you can win anxiety, and there is nil depression. So these are the cycles, how we influence. There is behavioral therapy cycle, definitely we need those behavioral therapy cycles, you know, like as we see ABC. And on the other hand, we have yoga cycles, that is the breath, body, and mind. These two we can connect through the GB axis. It's beautifully connected, and it is neurobiologically back up so that we can influence. So if you have any bodily symptoms, any gut symptoms, you can relieve it through influencing the vagus nerve through proper breathing exercises or proper pranayama. On the other hand, by having proper gut function, we can influence even our brain, so that there is a conducive situation where a person will be interested in modifying their thought process and becoming more active and interactive in their therapy sessions. Coming to the yoga integrated behavioral therapy techniques, that is, mostly they are exhale based asanas. Remember, when you do exhalation, so we are going to do exhale, hold, or prolonged exhalation. That actually improves the stimulation of the vagus nerve, and it also causes more rest and relaxation. That means it activates the parasympathetic nervous system. So whenever you constrict, whenever you contract, whenever you bend forward, or whenever you shrink, you have to exhale. Whenever you open up, like in certain this thing like Virabhadrasana, or in case of Dhanurasana, so all those asanas, we are opening up our chest. So we are doing them in an inhale position. But these postures which actually constricts, they are using exhale. So we call them as exhale based asanas or postures. Examples are forward bend postures like Tadasana. You always better start with Tadasana. In our tradition, at least, in Krishnamacharya Yoga Mandiram, we mostly start with whichever position you start, like in sitting or standing, you know. But if you are standing, we start with Tadasana. Uttanasana. Uttanasana is this first figure here, bending forward, sitting straight up, breathing in and breathing. As you exhale, you're going to bend forward and breathe out. Like I will just explain to you this Uttanasana in standing, this second figure here. So standing, you're going to have your hands on your side. So as you inhale, both your arms goes up, and as you exhale, you are going to bend forward, you know, and come achieve this position. So then again, you can stay there, take a couple breaths if you can, and then come up as you inhale, and then as you exhale, drop your hands down. But you go to the posture when you are exhaling. So that is the posture. These are the postures which uses exhale to reach to the main posture. Prasharita Pada Uttanasana is this one, this third one. And then Paschimottanasana is sitting in forward bend. Sharvangasana also. So it's important to understand Langana. Langana means mostly relaxing postures, you know. Relaxing postures help to relax your brain and body. Asanas to stretch the psoas muscle. Hope you all remember the psoas muscle that connects the lumbar spine with the thigh bone. So these are simple stretching and asana poses to stretch. So that is a modified cobra here down the last figure here. This is the Gopal Tapidam, like the pigeon's stretch. And these two are important stretches. You can lie down on a couch or a bed, like your bottom touches the edge of the bed, and you can leave the one leg down hanging while you bend, fold, and hold the other knee towards your chest. In that way, you are stretching the iliopsoas of this hanging leg. You know, this is another important stretching posture, the first one for the iliopsoas muscle. But here you have to kneel down. If you have any knee issues, probably this is not going to be something that you're going to enjoy doing. You can do either this way, lying on a couch, or you can do this modified cobra where you lie on your stomach and raise your head and neck up along with your chest with your hand support. So these are all the stretch poses. See, I'm just giving examples. There are many other poses that you can use for all these this thing. So if you know any poses you can use. The concept is you have to stretch your iliopsoas. Okay. In the first thing here, the concept is concentrate doing more exhale based postures. But here all these postures are actually inhale based process. So you're going to inhale doing, if you want to stretch your psoas muscle, you have to do inhale based poses more. And if you want to relax your mind and calm down, you are using more of exhale based asana. But see, it's always advisable to see a competent yoga therapist who can build up a course plan for you based on your individual requirement. Yoga therapy is never a group session. It has to be one single goal-oriented group session if needed, and that group has to be a very small in number so that there is more attention. Otherwise, if you have any specific goals, it's always to go with one-on-one yoga sessions. Next is pranayama. That's interesting. So the main thing in pranayama, when you are trying to relax your body and mind, you're going to use all the pranayama which are going to be relaxing and calming down, and those which actually stimulates the vagus nerve. The first one is the Chandra Vedana pranayama. Hope you all know. Chandra Vedana pranayama is mainly using your left nostril for breathing in and out. Sitali pranayama, this is another important pranayama. They have done a biochemical analysis of our saliva before and after doing the Sitali pranayama, which has shown increase in the biochemical content of the saliva, particularly human growth hormone and the serotonin. This pranayama is important in maintaining our brain health. Next comes the Ujjayi pranayama. Ujjayi pranayama, once again, as I told, as we saw the connection of the vagus nerve. The vagus nerve also connects the windpipe. So by doing Ujjayi pranayama, we are actually stimulating the windpipe, particularly the larynx and the pharynx. That will in turn relax the brain and causes a conducive situation for the cognitive function. Exhale and exhale hold. So always practice exhale, like concentrate on exhale. I don't say that you have to just do exhale, which is not possible, but you have to concentrate mainly on exhale and exhale hold if your goal is to relax your mind. The Brahmari pranayama, that is more important, like what we demonstrated yesterday. Brahmari pranayama also has a huge impact on relaxing our brain. Nadi Shodhana is the most important pranayama here because it directly acts on the autonomic nervous system. It influences what is called as Vada and Ida Kalai. It is nothing but Ida Kalai and Pin Kalai. It is nothing but the two main branches of autonomic nervous system, the sympathetic nervous system and the parasympathetic nervous system. The Nadi Shodhana is believed to bring a balance between these two systems of the autonomic nervous system, which will in turn produce calmness, quietness in the mind. Mantra chanting, once again, Om chanting. There is a huge scientific foundations for chanting Om. What we are using is not the actual Om. Once again, it is a sound of Ma. Like if you don't want to do Om, you can just simply, when you are exhaling, you can chant Ma. That Ma sound actually causes relaxation in the brain. And if you're not against it, you can chant Om Somaya Namaha. Somaya is none other than the moon. The moon is said to be relaxing, right? Compared to sun, it is a relaxing energy. So we are inviting a relaxing energy in the form of the moon. So increasing the concentration. Of course, people use auto suggestions and all of other stuff in order to improve our cognitive function through mantra chanting. There are lots of, like, people advise several mantras and kirtans and lots of chanting. People can, they are suggested in the scriptures, and of course, there are lots of scientific research going on nowadays. The scientific impact of those scriptural mantras, and the results are really enhancing and encouraging. If you are inclined, you are welcome, but those mantras, they say you have to learn from a competent teacher. And the bhavana, visualization, visualization, of course, we are going to see once you do all those vagal nerve tone improving exercises, you can visualize as if, like a calm and peaceful, serene atmosphere. You can visualize the moon, you can visualize a calm waterfall or a calm river, all those stuff you can visualize in order to relax your brain. So these are stuff I'm not discussing much because probably most of the yoga therapists will be able to help you out with all these tools. Now comes the most important vagus nerve stimulation. So when you are stressed, we have to stimulate the vagus nerve. The idea is to increase the vagal tone, right? The first and foremost thing is acute cold exposure. Splash cold water on face. Wash your face with cold water. You see an immediate change. Or go have a cold shower. Of course, it's still doable in countries like India, but not in countries like Canada, where I'm living now. We cannot have this cold. But of course, we can expose ourselves to snow, so that actually stimulates the vagus nerve. Or drink cold water. That's going to help. Next is humming. This is where the Brahmari Pranayam comes into play. Brahmari Pranayam actually stimulates the vagus nerve because of its humming quality. So chanting Om Ma increases, they have found that it increases the heart rate variability, An important benefit of these pranayams are the important benefit of this pranayama is they normalize an irregular heart rate. So having positive social relationships, thinking compassionate about others. See, this is what we all are lacking now. Thinking compassionate about others. We are always self-centered. We have to think out and think about others who are in trouble and try to go help. Positive emotions like serenity, joy, and hope, and meditation. I think someone have to mute your listening so that everyone can listen. So the pranayama, deep breathing exercises, breath hold, ujjayi pranayama, and here comes the kapalbhati. Why kapalbhati? Kapalbhati actually improves your abdominal tone. It massages the organs of the abdomen, mainly the gut, so that improves the circulation to the gut. When the circulation to the gut improves, it automatically influences, stimulates the vagus nerve. So the meditation, breathing-based meditation. So what you're going to do in meditation, there are lots of meditation, but meditation techniques taught by different schools of thought in yoga and meditation. There are mindfulness, everything. But a very simple meditation is what we did yesterday, the breath observation. Just observe your breath. Once you start observing your breath, automatically you will tend to close your ears and you internalize. Meditation is nothing but you are internalizing yourself and you concentrate. Maybe you can bring your concentration between your eyebrows and then try to concentrate how you breathe in and breathe out. You can follow your breath from your nostril to the lungs and then come back from your lungs to the nostril, and gradually you can increase the time of your breathe in, inhale and exhale, as we saw yesterday with the numbers. Okay, so the next important thing is the massage, especially feet and neck along the carotid sinuses and abdominal. See, very important. Many times we miss when we have abdominal problem. We try to go have antacids and other stuff. We try to have like soda and other these beverages, to support your abdomen. Just take your hands and massage your abdomen. Massage your abdomen. If you can have some hot compress, like hot water fermentation of your abdomen. And in naturopathy, what we do, we apply mud packs on the abdomen. So why mud? Mud is nothing but earth. Earth makes you more grounded. When you are grounded, you are making a connection between your body and the earth, which makes you grounded. When you're grounded, your cognitive function increases, your vagal nerve tone increases too. So you can apply mud. What you can do, simply take mud, like, near your house, wherever it shouldn't be a mud from elsewhere. It has to be mud that is taken near from your wherever you are living. So just take mud, like mix with water, make it as a paste, and you can cover it with a thin towel or a cloth, and as a wet mud, just apply it on your abdomen and lie down, relax, and you can concentrate doing meditation or pranayama in lying with the mud packs on your abdomen. That actually makes you more grounded. And the abdominal massage, massage when you have these psychological symptoms, massage your abdomen. That's going to improve the circulation in the abdomen. What do that mean? If the circulation in your abdominal organs increases, that means the circulation, the sympathetic nervous system is being shut down. So that's going to redirect the blood circulation to your abdomen rather than to your periphery, like what the sympathetic nervous system does. So other important thing is the ear. You have to, actually I have to demonstrate this. Just one demonstration, right? After a long time. Okay. Hope people are still enjoying the session. I'm sorry for being too much of informations, but I think that is going to help us to understand the background. So with the massages, first thing is the abdominal massage. Have your hands. See, your hands has the healing powers. Have your hands and massage your abdomen. That's going to improve blood circulation. That's one thing. Second thing, the vagus nerve supplies this area. Like it supplies the ear and the neck, skin around there. So you can massage your neck. And important, you're going to massage, like take one hand here, massage this muscle of trapezius. Massage the muscle of trapezius. Massage your muscles. You're going to do on your own. If you have a wife or husband, you can definitely make use of them. Massage your trapezius. See, three muscles which are important. One is the sternocleidomastoid, which is here, which connects our clavicle and sternum to the mastoid process here. So you're going to massage all, hope you are able to see. You're going to massage all these muscles there, and then you are going to massage this trapezius that goes all the way to the neck. Massage the base of the skull. All those muscles. That's where the trapezius muscle is getting attached. Massage them, and then you have these levator scapulae, like keep massaging them. So what you are trying to achieve, you are trying to increase the vagal tone. Don't think that you are just massaging. So that is where massages are traditionally followed by our people long time with the Ayurvedic practitioners, So the next important technique is the ear lobes. What are you going to do? You're going to hold your ears like that. Please observe what I'm doing. So you're going to hold and pull your ears up like that. What happens to me when I do that? When you pull up, it increases. Like you tend to take a deep breath. That much influence this simple technique. This is so simple that you can do. You can try these techniques even in a panic attack, like just. So you're going to pull your earlobes, and then pull up. It makes me to take a deep breath. Try that, it makes an enormous impact on our psyche, So even massaging here, that is where, like if you remember the vagus nerve stimulator, they are implanting there, the stimulator, right? By stimulating them, you are going to actually increase the vagal tone. The other important stuff here is your posture. These muscles, when the sternocleidomastoid and trapezius are tight, you develop a posture, what is called as forward head posture. We are always like that. Either you are typing, you are driving, you are cooking, you are washing your dishes. We are always like sitting like that with a forward head posture that brings our chest forward too. When we are sitting like that with a hunchback, that actually brings your head forward. That's going to disturb not only the vagal nerve, but all the nerves that comes from the brain stem, So another important muscle to be stretched is the suboccipital extensors, which are situated here. What you're going to do, I'm going to demonstrate from the side. What you're going to do, you're going to stand or sit straight, have your shoulders on your side, and then you are simply going to retract your chin back. Your eyes looking level, you are not going to look down. If you look down, you will do this. You will tend to bend your head forward. Don't do that. You're going to look your eyes level and you're going to retract your chin back. Many people, when they do this, they also try to round their shoulders. No, the shoulders have to be on the side and retract your chin. Simply doing this actually elongates your spine. Simply tucking your chin, chin tuck exercises. Once you start doing this, it releases the vagus nerve from the entanglement because of the poor posture. And the other end, the chin tucks. Yeah, wait for the questions. Yeah. The other thing is the chin tuck. Also, you have to maintain chin tuck whatever exercise you do. I've seen many people doing biceps curls with bending forward and doing biceps curls. They are going to use all the muscles, So even for doing biceps curls, if you hold your chin tuck and do your biceps, then you are isolating the muscle so that the effect will be better. So those stuff you're going to do. The other one, there is another one more technique to release the vagus nerve, improve the vagal nerve tone. What they say, you're going to sit, you're going to clasp your fingers, have your hands like that, Either you lie down in that position or sit down in that position. That's a relaxed position. And you're going to bring your eyes to 3 o'clock position, like in a clock. If you see 3 o'clock is looking like that, I'm going to just look like that and just concentrate there. I'm just going to wait. I'm going to do that when I'm stressed out or I'm anxious. I'm just going to lie down. It has to be in lying down. Or if you are coming to sit down, if you're sitting in a couch or in a car seat, you can just, before starting to drive, you can try that. Just relax and move your eyeball to the 3 o'clock position and stay there until you feel like swallowing or until you get a deep breath or until you get a sigh. that notices that your vagus nerve is getting balanced there, and then you can start combining, continuing whatever you are doing, just few minutes, like maybe maximum 2 to 3 minutes. If you're stressed out, you can try that, So with that, let's go on to our presentation back here. Of course, laughter, gargling, with hot water gargling or whatever you are doing, we are trying to actually stimulate the vagus nerve by stimulating our larynx and pharynx. Nada yoga. This is another very important, interesting thing. Okay. That's a huge science. It's a sister science of yoga, the Nada yoga. I'm not going to go in depth of that science because it's a separate presentation. But I'm going to say how you can use this Nada yoga for anxiety and any disease. Any disease, even if it is a fever, you can still use this Nada yoga. The idea is, of course, we know we breathe through both nostrils, but the breath doesn't happen in both nostrils every time. If you can check, just have a finger and check. Of course, the air will be blowing on both your nostrils, but one nostril you will feel more warmth compared to the other nostril. That means that nostril is predominant in that given time. Like, okay, I am feeling tired, frustrated, So just have one finger like that and breathe out. If, for example, now I am feeling more air coming through my left nostril, So if you are suffering from any ailment, you can simply switch the passage of air to the opposite nostril. What you're going to do? Very simple. In the ancient days, if you see our gurus and those munis and sages, they will be sitting with that danda, That danda, they are not using simply holding the danda. They use the danda to switch this nada, the breath, So there are certain activities we can do, like, it's a huge science. Like, there are certain activities that you can do when your breath is flowing through your right, and there are certain activities that you can do when the breath is flowing through your left. You can also influence your concentration by getting direction to the nada. I'm not going into all those subjects now. What you can do simply, if you feel anxious or any disease condition, simply check which side you are breathing. If you think that you are breathing more through left side, simply block that nose and continue breathing on your other side. Like within few minutes, you will see that there is more airflow happening in the other side. The other way you can do is, if you want to switch from left to right side, you can simply lie down on your left side. Whichever side you want to switch, have that side higher. So you're going to lie on your left side. Within few minutes, you will see that there is more air moving through your right nostril. So what it does, so this calms down, it actually activates, increases the vagal tone, and it balances the autonomic nervous system and brings about, it shuts down the sympathetic nervous system and reduces your anxiety and other symptoms. You can see according to behavioral therapy, it's hard for someone to sit and analyze your thoughts when you are in a panic attack, right? But you can definitely do these stuff in order to influence your brain, So you can do all these techniques, particularly the Nada yoga, which has got, like, we even use this Nada yoga through the cycle of Amavasya and Paurnami, the days. There is a measurement in which nostril it should start when early in the morning, So that's a different science. Probably I will try to do that in maybe in our next opportunity. So the next is Yoga Nidra. This is another important thing. That is where the Jacobson's relaxation techniques came from. Yoga Nidra is something that we follow traditionally. So you are going to lie down in Shavasana. You're going to lie down with a comfortable position. But the importance here is any asana, you have to be comfortable. At the same time, you have to be 100% aware of your situation. You are not going to sleep in that position. If you're going to sleep, then that is no more Yoga Nidra. Whenever yoga comes, there comes increased awareness. So in that position, you are going to tighten each and every part of your body and relax. It's a cyclical procedure. That itself is minimum half an hour to 40 minutes long demonstration, which probably you can learn from any yoga therapist for that matter. Managing intense stress, anxiety, and suicidal thoughts. Huge topic to be discussed in a separate session, but I would like to address this because of the increasing suicidal thoughts that the youngsters are getting. Manage your fear. You have to manage. See, fear is something that's going to be there. It's never going to go. You have to analyze your fear. Why this fear is coming? As I told in the beginning, the fear comes from the impending need for change. We all know that we all are in a situation, uncertain situation, but we also should know that we have to grow out of this pandemic. We have to evolve as a more empowered, more resilient, and well-evolved new human beings. Probably that's how I see this coronavirus situation. This probably is going to refine and going to produce better human beings, maybe. And there is Osho Sankalpa meditation. This is one thing I would like to share. Of course, there are a lot of meditative techniques that you can follow, but this one, if someone has a suicidal thoughts, you can teach this one for them. What he says, if you want to achieve some goals, what he says is, it's particularly he wants this everyone to practice before and after sleep. Before sleeping, what he wants you to do is, let me demonstrate. So the next two things are, I will demonstrate that. Avoid being alone, listen to music, satsanga, that's what we call it as. You can go to satsanga where you can listen to like whatever religion you feel, like it is a Christianity, an Islam or whatever. Go to those religious associations where you can listen to those scriptures which might calm down your brain, and attend prayers. So what he wants to do, the yoga meditation, Sankalpa Yoga, he wants to breathe out. Breathe out. Never take a breath in. Wait, breathe out. Further breathe out. Further breathe out. Keep breathing out, breathing out, breathing out without taking a breath in. Keep counting. It's unable to count, but never take a breath in continuously until every cell of your body is struggling for oxygen. Keep breathing out, breathing out, breathing out. So every cell in your body is struggling to get the next breath in because of the oxygen continues. So in that stage, suggest your brain that I have to live through this pandemic. I have to live. I am not dying out of any such external atmosphere. I will win and I will come out successful. Keep suggesting, telling that auto-suggestion when your entire body, every cell of your body is struggling for gas, oxygen, then that suggestion gets registered in every single cell of your body, so that if that helps to change your mind of suicidal thoughts, So of course, this technique, please don't try if you have any existing breathing difficulty. This is mainly I'm suggesting, of course, he advised for every good activity or every good habit, he wants us to try this, So you can register that in your brain, and every cell of, see, for example, simple, like if you want to get up early in the morning, like 5 o'clock every day without setting an alarm, before sleeping, do this. Block, exhale, 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 and suggest every cell of your body, you should get up by 5 a.m. in the morning. Train and do. He suggests, Osho, Rajneesh Swami has suggested this kind of meditation. I think we can use that for balancing, counteracting the suicidal thoughts. There was an interesting Dalai Lama, when asked what surprised him most about humanity, answered, man, because he sacrifices his health in order to make money. Then he sacrifices money to recuperate his health. And then he's so anxious about the future that he does not enjoy the present. That's what we are thinking, we are doing now. We all are thinking that what's going to happen? When is this pandemic is going to happen? It's closed down. When is this lockdown is going to release? When am I going to go back working? No, stop. Enjoy your time with your family. Like you haven't enjoyed, if you are 40 years, you haven't enjoyed all this time. Now take this time, maybe another month, another 2 months, take this time to enjoy with the most important people in your life. The result being that he does not live in the present or the future. The last line is the one which is amazing. He lives as if he is never going to die, and then dies having never really lived. Isn't that amazing? Amazing wisdom from an amazing person. So we have to live this life in the presence. This is what is the situation. I also would like to, before giving the thanks, I also would like to have these words of Mahakavi Bharati, Achamillai, Achamillai, Achamenvadillaye, Uchimidu Vanidindu Virindra Podilum, Achamillai, Achamillai, Achamenvadillaye. So what we are facing now, the pandemic, is no bigger than the whole sky is crashing on our body, our brain, head, So never think this is the end. This is possibly going to be a new beginning in the history of human being. A big thanks to one and all for bearing with me all this time. Thank you so much for the organizers and all our professors. We can open the session for questions, I guess, if there is time. Are there any questions?
Dr. Nirmala, madam.
Thank you.
I think
all this everything for thanking.
Your questions are there in the chat box.
Yeah, I'm just looking.
Yeah.
It's moving so fastly, so I couldn't grasp.
You can just stop one or two things which is interesting, which is related to the today's topic. You can just answer.
Managing repetitive thoughts. See, that is what. See, before even analyzing the thoughts, you have to see. That's what all this fear, anger, everything, comes from. That's what yoga philosophy says. It all comes from an impure ground. So you have to clear the ground in which better seeds can give better plants. So before thinking about the seeds and the tree, we have to do our homework, clearing all the brain fogs and stuff, so that our cognition is better, at least even to analyze our thought process, so that we can process it. Repeat the breathing exercises to get deep sleep. Okay. I don't think we have enough time. Any more questions? Which yoga is best for fat loss? Yeah, see, weight gain, if it is due to this anxiety and psychological problem, definitely you can influence. See, of course, There are exercises, go for walking, aerobic exercise, everything helps. But if you have a poor vagal tone, whatever exercise you do, it's not going to help you. So you have to improve your vagal tone so that whatever exercise you do is going to help you in actually improving your yoga. You can do anytime. Before food, after food, before sleep, after sleep, morning, afternoon, evening. It is therapy. When you are doing yoga for higher goals, there are set rules to do. Like it has to be in the morning, it has to be in the empty stomach. All those rules comes only when your goals are higher. But when your goals are like trying to come out of a panic attack, or when your goals are trying to come out of an anxiety attack, you cannot wait for an empty stomach. You have to do right there, right? So these therapeutic yoga we can do anytime. There is no time limit. But when you are doing yoga for other higher this thing, as you see with yoga, what happens, it itself purifies your thought slowly. Like, if for example, someone is asking, I want to stop smoking. Can yoga help? Don't do like that. Just start yoga. Yoga is simply elevating your health. It's going to take you from down and gradually it's going to build, take you slowly to a higher stages of health status. Automatically it reduces the urge to do all those bad habits. So if you're just going to ask me, can I do some yoga to stop smoking, then it's not going to happen. Start doing yoga and all those extra benefits are going to join. You're going to gain all those stuff in the way of doing yoga.
Okay. Thank you.
Higher stages of health status automatically reduces the urge to do all those bad habits. So if you're just going to ask me, can I do some yoga to stop smoking, then it's not going to happen. Start doing yoga and all those extra benefits are going to join. You're going to gain all those stuff in the way of doing yoga.
Okay. Thank you. The next question is, yes, sir, Professor Ilango, sir.
There is one question. Like, should we do yoga before pranayam? Traditionally, yes, you have to do yoga asanas before. See, that is how, like yaman. See, the other thing, if you want to achieve all the benefits of yoga, then you have to follow the Ashtanga yoga. Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, and then Samadhi. So you just doing all the nonsense, all the ill behavior, having all the ill behavior, and if you're continuing to do your yoga and pranayama, is that going to prove effective? I don't think so. You also have to refine the yamas, rules and regulations that you have to follow in your personal life and in your societal life.
Okay.
So his main question is, in what way interacting or incorporating yoga helps in physiotherapy? Definitely, yoga is, the main goal of yoga is to elevate your well-being. So if you want a better, so if I want relieve my back pain, of course, people come to us for physiotherapy. In the starting stage, we do physiotherapy, and then it relieves the back pain. But is that going to come back? Definitely, yes, it's going to come back as long as you don't do the follow-up exercises. But as the follow-up exercises, instead of doing general exercises, if you do yoga therapy, then the results are going to be better. So that yoga comes as an additional specialization for a physiotherapist. If a physiotherapist has a background in yoga, that's going to help us. For example, I had the opportunity to learn yoga from our great Krishnamacharya Yoga Mandiram. That's a more clinical yoga therapy. In fact, I had my visa. I had to come here to Canada before even completing my course. I had to cross the borders, right? So I came and I went back within a month, and then I completed the course, and then only I came back because I did not want to lose that knowledge. But that is helping me a lot in my day-to-day practice as a physiotherapist. Hope I answered your question, sir. Thank you so much. Any more questions?
Yes, sir.